Graves' disease. Graves' disease is an autoimmune system disorder that results in the overproduction of thyroid hormones, also known as hyperthyroidism. Although a number of disorders may result in hyperthyroidism, Graves' disease is a common cause.
Graves' disease can affect anyone between the ages 20 to 40 of age, although women are 5 times more likely to develop it than men.
There are two types of Graves' disease, ophthalmopathy and dermopathy. The first type of Graves' disease is ophthalmopathy. It is a result of cytokine-mediated activation of fibroblasts in the orbital tissue behind the eyeball, and it can result in inflammation and swelling around tissues and other muscles of the eye. It usually occurs 6 months before or after diagnosis, and it affects about 30% of people who have Graves' disease.
The second type of Graves' disease is dermopathy. It is an uncommon manifestation of Graves' disease. It is the reddening and thickening of the skin, most often seen on your shins or tops of your feet.
The thyroid gland is a gland that is located below the larynx. It is composed of follicles. It is controlled by the thyroid-stimulating hormone, TSH, secreted by the pituitary gland to stimulate thyroxine, which stimulates the metabolism. Therefore, the thyroid gland controls the body's metabolic rate.
Signs and symptoms of Graves' disease include anxiety, a fine tremor, heat sensitivity, moist skin, enlargement of thyroid gland, goiter, change in menstrual cycles, erectile dysfunction, bulging eyes, thick red skin, and rapid or irregular heartbeat. The immune system normally protects the body from foreign invaders such as bacteria and viruses. It destroys foreign invaders with antibodies produced by blood cells known as lymphocytes. Graves' disease, antibodies bind to thyroid cells and stimulate those cells to overproduce thyroid hormones, thus resulting in an overactive thyroid. The same process happens in Graves' ophthalmopathy.
In normal homeostasis, if there were a decrease in thyroxine, the pituitary gland would release TSH, or the thyroid-stimulating hormone, and it would be secreted in the thyroid gland, and it would result in an increase of thyroxine, therefore bringing the body back to normal homeostasis. In homeostasis and Graves' disease, the pituitary gland releases an excess amount of the thyroid-stimulating hormone, TSH, that is secreted in the thyroid gland, leading to excess amounts of thyroxine.
The thyroid is composed of closed sacs, also known as follicles, lined with special thyroid cells. These cells secrete thyroglobin, a large protein that acts as a storage molecule from which thyroid hormones are made and released into the blood. The rate at which this occurs is regulated by thyroid-stimulating hormone, TSH, which activates the thyroid cells by combining with TSH receptors found on the thyroid cell membrane.
Treatments for Graves' disease. Radioactive iodine therapy. Take radioactive iodine by mouth. Radioiodine goes into thyroid cells and destroys overactive thyroid cells. Anti-thyroid medication, propylthiouracil, tapazole. Beta blockers blocks effect of hormone on the body. And there's surgery, which is remove all or part of the thyroid, and you will need a lot of treatments to supply body with normal amounts of thyroid hormones.
Summary of Graves' disease. We first talked about what Graves' disease is, and it's an autoimmune disorder. We talked about who can get Graves' disease. So anyone can get it, but it is more common in women. We talked about two types of Graves' disease, ophthalmopathy or dermopathy. We talked about signs and symptoms of Graves' disease, bulging eyes or a goiter. We talked about homeostasis. So in homeostasis and Graves' disease, an excess amount of the thyroid-stimulating hormone is released, resulting in excess amounts of thyroxine. We talked about two different kinds of proteins, So the first one is an antibody, and it binds to the thyroid cells, causing it to overproduce thyroid hormones. The second protein is thyroglobulin, and it acts as a storage molecule where the thyroid hormones are made and released. Then we talked about cell membranes. So the TSH receptors are found embedded in the cell membrane, and they activate the thyroid cell. And lastly, we talked about the immune system and Graves' disease, and the treatment, which could include beta blockers.